Hello and welcome to our informational webinar called Medicare Made Simple. I'm David Middleton. I'm going to be your host, and our team has put this webinar together to help a person like yourself, maybe new to Medicare or even been on Medicare for a while, to understand the basics of Medicare and take the complexity and confusion out of it, much like the guy on the left looking at the maze of Medicare is experiencing. You probably felt that way before, perhaps many times, I'm sure. Who are we? Well, we're a team of three guys, two of which are a father and son team, Team Middleton Healthcare. My name is David Middleton, 64 years young, currently live in Raleigh, North Carolina, along with my wonderful wife, Gail, of 40 plus years. And we've raised our family of four kids in the great state of Georgia. And as of 2023, we have six grands and counting. Have a ministry background of about 20 years before becoming a Medicare professional about 18 years ago, and have thoroughly loved it. Our partner in Atlanta is Jim Evans. Jim's 49 years old. He's a seasoned entrepreneur of 20 years and has been a Medicare professional for about 14 years now. So glad to have Jim on our team as he brings a lot of practical wisdom and insight to the team. Our second born son, Josh Middleton, joined us on the team in early 2022, coming out of the elementary school fundraising business that he'd been in for about 10 years. He's been married to our wonderful daughter in law, Carly, for about 10 years now. They have three wonderful children, three of our six grands right here in the Raleigh area. Very proud and excited for Josh. He's done a phenomenal job learning the Medicare business and doing a great job just early on. So, how can we help? Well, have you ever wondered, how do I make sense of all these calls and mail I'm getting regarding Medicare? What's the difference between parts A, B, C, and D and plan G, F, and N? Who can I trust to help me make a wise and informed decision? Well, that's what we're here for. Among other things, we're your non biased and independent advisor team. We represent multiple companies and we shop the market for you so you don't have to. We review your coverage every year, particularly during the annual enrollment period in the fall. And we're available to you throughout the year whenever you need us. And there is no cost for our help. That's right. You get our years of knowledge, experience, and expertise for absolutely free. Here's our roadmap of what we're going to cover here today: Medicare and what it covers, when to enroll in Medicare, how to enroll, your two main options, including drug coverage, how to decide on the best plan for you, and then a wrap up with summary and next steps. So let's jump right into it. What is Medicare and what does it cover? People age 65 or older that are no longer working and or losing group health insurance or retiring, for people under age 65 with qualifying disabilities they've had for 24 months, and it's for people of all ages with ESRD. Now, original Medicare does not provide Part D drug coverage, and preventive services are included for a zero copay for the things that you see listed right there. Now, what are the four parts of Medicare? Part A is hospital, Part B is medical insurance, Part C, Medicare Advantage, and Part D, Medicare prescription drug coverage. We're going to unpack each one of those as we move forward. First of all, Part A, hospital. What it covers is inpatient hospital care, skilled nursing care, some home health care, and hospice. And what it costs is, well, there's no monthly premium for it. However, you need to know that when you, all through our working years, they were taking that out little bit by little bit through the FICA taxes for the Part A of Medicare. When you turn 65, they turn that spigot off. You have a deductible of $1,632 days 1 through 60. That's for 2024 coming up. If you had an overnight stay in the hospital, that's what you're going to owe even for a one night stay. Ouch. You have daily co-insurance of $408, days 61 through 90, and then you can see what the skilled nursing facility co-insurance is there. Part B is your medical insurance, covers doctor visits, outpatient services, lab and x-ray services, DME durable medical equipment, and supplies. There's two cost factors associated with Part B. One is a monthly premium. It's $174.70 a month for 2024. If you're already drawing Social Security, they're going to automatically deduct that from your check. If you're not, they're going to send you a quarterly bill to mail in for that payment. An annual deductible of $240 for 24, Um, Part B coinsurance of 20%. You could be subject to 15% excess charge, not always, but there's no cap on out-of-pocket spending with Part B. Now, second, when to enroll in Medicare. There's two main times that you can enroll in Medicare. First is at 65 during your initial enrollment period. This is a 7 month window that begins 3 months before your 65th birthday month, then your 65th birthday month, and then it goes 3 months beyond there. Your Medicare always begins the first day of the month you turn 65, unless if your birthday is the first day of a month, it's going to bump to the first day of the previous month. But if you don't sign up for Medicare during this IEP period, you may have to pay Part B and Part D late enrollment penalties. Okay, what if you're already drawing Social Security coming up on 65? Well, you are automatically going to be enrolled in Medicare. You don't have to do anything. You're going to receive that red, white, and blue Medicare card 3.5 months prior to the first day of your 65th birthday month when your Medicare goes into effect. And that Part B premium of 174.70 will start being deducted from your Social Security check in your 65th birthday month or soon thereafter. Now, if you're not already drawing Social Security, and either retired with no health insurance, you need to know you are not automatically going to be enrolled in Medicare. You have to manually enroll, and we'll talk about that more in the next section, how to enroll. But if you're still working and not drawing Social Security, you can choose to enroll in Medicare up to 6 months before your 65th birthday, and you can delay adding Medicare Part B and stay on your group health insurance plan if you like it. All right. The second time that you period of time that you can enroll in Medicare is after 65 during your special enrollment period. This is usually when you plan on retiring and or will be losing your group health insurance, or if that group health insurance changes and you decide you want to start on Medicare. But you must manually enroll via Social Security. That is, start your Medicare Part B. We'll look at that more in the next section again. And a tip is it's helpful to start this process about 90 days before you want your Medicare to start. You must provide proof of employment all the way back to 65 and proof of creditable health insurance coverage. And most group health plans are considered creditable coverage. Some helpful forms to provide is the L564 you give to your HR department and the CMS 40B that tells Medicare what month you wish to start your Part B. Now, there's three other times other than that initial enrollment period that you can make changes to your plan. The first one is in the fall every year, annual enrollment period. You can make changes to anybody on Medicare can make changes to your plan. Those changes will take effect come January 1. Open enrollment period, you can make another change if needed, January 1 to March 31, and then the special enrollment period throughout the year. The most notable of those that would be if you make a move, a physical move, and you move location. That special enrollment period. Now, how to enroll in Medicare? This applies whether you're at 65 during your initial enrollment period and you're not drawing Social Security, or after 65 using your special enrollment period. You have no Medicare Part B and you need to activate it. Well, you must manually enroll in one of three ways. First, in person at your local Social Security office. That is not the most preferred way that we recommend, but if you did it, we recommend calling first to schedule an appointment. Second is you could call the main Social Security number. And third, which is what we recommend, is to enroll online within 3 months of turning 65 or of needing to have your Part B start. Now, when you schedule an initial one-to-one call with our team, we'll help you with this. We'll take care of it all. You don't have to figure out anything relative to this. All right. We're going to look now at your two main options with Medicare, including Part D. The first option is Medicare Supplement, also known as Medigap. Option two, Medicare Advantage, also known as Part C. Let's jump into Medicare Supplement first. You can keep original Medicare and add Medicare Supplement insurance that covers some or all of the costs not covered by Parts A and B, and or You could add a Part D drug plan that's offered by private companies. Here's a simple chart that just shows the number of Medicare supplement plans, and they're all lettered across the top to the right of the green arrow. The two most popular ones that I have focused on here is a Plan G and a Plan N, and we're going to dive into those two plans. First of all, comparing the similarities of these two plans. Both cover the Part A hospital deductible 100%. That's 1632 for 2024. Both cover the remaining 20% Part B coinsurance after Medicare pays the 80%, but both require you to pay the Part B annual deductible of $240 for 2024. Some of the differences between the two is number one, you're going to pay $20 copays for doctor visits, both primary care and specialists. With an N, with a G, there are no copays for doctor visits. Number two, $50 copays for ER visits. With a Plan N, there are zero copays. With a G, you could be subject to Part B excess charges, that 15%, whereas you're not with a G. And the monthly premium for an N can run you in the range of $90 to $100 a month, starting out at 65 versus 120 to 130 for a Plan G. Now, second main option is a Medicare Advantage plan, which combines parts A and B of Medicare. You get additional benefits inside an Advantage plan like dental, vision, hearing, fitness, over the counter, and most of these plans cover prescription drugs as well. What are some similarities between Medicare Supplement and Medicare Advantage? First of all, well, you must have Part A and B to enroll in both. You can enroll prior to turning 65 with both, up to 6 months before with a supplement, up to 3 months with an Advantage. Both plans are federally regulated. Some more similarities. Number four, there are many different plans with supplements. They're all lettered. Many different plans with Advantage plans, HMO versus PPO, MAPD, which includes drug coverage versus medical only. With both of them, a policy, Medigap and MedAdvantage, they cover only one person. Spouse has to get their own. And they're both lifetime policies, can't be canceled except for non-payment of premium. Okay, what are some of the differences between MedSup and MedAdvantage? Number one, a supplement is going to work with original Medicare, the red, white, and blue card, and pick up the gaps and out of pockets of original. An Advantage plan replaces original Medicare through private companies. You have guaranteed coverage with a supplement when you turn 65 or first enroll in Part B with no health questions you have to ask. With an Advantage, there's guaranteed coverage at all times, no health questions at all except their ESRD. There's no networks with a supplement. If a doctor accepts Medicare, they must accept your supplement. And that applies if traveling and away from home. There are HMO and PPO networks with Advantage plans. With the PPOs, you can go out of network, pay a little higher copay. If you're away from home, you are covered in the event of an emergency. Some other differences, no referrals are needed to see specialists with a supplement. Referrals may be needed, although not for PPOs. And to be quite honest, HMOs are requiring them less and less now. It's not near as much of an issue now. No pre-authorizations are needed for more expensive services with supplements, whereas they're often needed for more expensive services with Advantage plans. There is no annual enrollment period for supplements. Coverage stays the same from year to year. Only your monthly rate increases. With Advantage plans, there is an annual enrollment period, October through December, where premiums, copays, deductibles, and benefits change a little bit, not a lot. Other differences, number seven, you have less out-of-pocket copays, but with a higher monthly premium. It's just the opposite with Advantage plans. You have more out-of-pocket copays, but a zero monthly premium. There's no ancillary benefits or drug coverage included with the supplements. Advantage plans include both of those that you can see there. Annual Part B deductible is mostly your out-of-pocket cost with the supplements. It doesn't even exist with Advantage plans. And you can change plans any time of the year with supplements as long as your health is okay. You can change plans at certain times of the year, like the AEP and the OEP we've already talked about. All right, looking at some similarities between Medicare Advantage plans, HMOs versus PPOs. Both have a network of preferred providers and facilities and cover you for emergencies out of network. Both have an annual maximum out of pocket or moot to limit the members' out of pocket cost each year. Both have low to zero monthly premium plans with drug coverage included or not included. And both provide rich ancillary benefits over and above the basic benefits. Neither one requires referrals to see a specialist. HMOs used to, but as I've said, most no longer require it. And the differences are just a couple here. HMOs may have slightly higher benefit amounts and lower copays than PPOs, but HMOs have no out of network coverage, whereas PPOs do with slightly higher copays. All right, let's look at some facts regarding Part D drug plans. These Part D drug plans are offered by private insurance companies. Part D drug plans that are bought to go with original Medicare or Medicare supplements are referred to as standalone plans. Many Medicare Advantage plans include drug coverage at no extra cost. All Part D drug plans use a formulary, which is a list of included drugs, and they include the following cost sharing features: premiums, copays, and deductibles. These drug benefits work off a calendar year. Coverage rules may apply for Medicare Part D drug plans, as you can see there. Usually 5 tiers of drugs. The tier ones and twos are generics, and then brands, tier 3 and 4. Even if you don't take any medications, if you decide not to get Medicare drug coverage when you're first eligible, you'll likely be charged a late enrollment penalty unless one of the following applies. You have other creditable drug coverage and or you get extra help. All right. Number 5, how to decide on the best plan for you. Just to mention here some other coverages that we can help you with are hospital indemnity plans. Those are particularly for Advantage Plan members. They help to cover the inpatient hospital copay, a few $100s for a certain number of days of an Advantage plan. Cancer protection, will recommend a lump sum cancer benefit. We also help with life insurance protection, retirement, and can help with state and federal assistance if needed. Now, to decide on the best plan for you, you need to ask and get answers to the following questions. Can I continue to see my preferred doctors and providers? Are the benefits I need included in the plan? Are my prescription drugs covered? And if so, what will they cost? What are the plan's copays and deductibles, medical and or annual drug? And how much will I pay in total premiums each month? Beyond the monthly Part B premium, is there a premium for my Advantage plan or hospital indemnity or cancer benefit? Just a reminder of what we're here for. We're here to help you understand the basics of Medicare upfront, help you to get enrolled into a Medicare plan that's right for you, help you get off to a great start in your plan and Medicare journey. We're available to you year round when needed, especially in the fall in that annual enrollment period. And we protect you long term from rogue agents and call centers out there that are just out to enroll you, but they're never going to be available to you. And we do all of this totally free of charge to you, both now and going forward. Couple on the right, they know that to be true. That's my mom and dad. All right, we want to say a very big thank you for joining us today. Hope this has been very helpful to you. If so, get back with the person that recommended you, referred you to this video, and we just have enjoyed this time together. God bless you and take care.